Hi everyone, this is Nurse Favor. I'm a registered nurse and we're going to be talking about something very important today, breast awareness. Now, I know this is a topic that we all shy away from or it makes us nervous, but relax. It's a conversation that we all need to have regardless of our age and gender. And trust me, at the end of this video, you're going to be well informed, you're going to be walking away confident and empowered. Breast self-examination is something that is being done every month, once every month, and it is being done to understand your body. You do a breast self-examination to understand your breast and to know when something is out of the usual. And early detection or early noticing of an unusual change in your body can save your life. So sit tight with me, tighten your seatbelt, and come watch. Our hormone plays a very big role in how our breast feels, especially during our menstrual cycle, pregnancy, and menopause. Sometimes you would notice that your breast is a little bit tender, heavier, and slightly lumpy. Do not worry, all of that are completely normal. Breast awareness isn't just about you doing a self-examination once in a while. It is about you knowing your body and your breast in general, so that you would be able to notice when something unusual has occurred in your breast and your body in general. Breast examination is usually done once every month and is typically 1 week after your menstrual cycle. Now relax, sit back, and let us talk about how to check your breast safely and correctly, because most times some people don't really know how to do this breast self-examination. They just do a whole lot of things and they just assume that, oh, they are fine. Now let me tell you how to do this correctly and safely. First thing you need to know about doing a breast self-examination is that it is being done once every month and 1 week after your period must have ended. If you're the type that no longer sees her menstrual cycle or you have an irregular menstrual cycle, chill. You can always do this every month. All you have to do is pick a day out of each month and then do the steps that I'm about to list out for you on how to check your breast. So step 1, you stand in front of a mirror. You're standing upright with your shoulder pad up and your hands on your hip. That way your breast is going to be in a symmetrical line. You will check out for the size, you check out for the shape, you check out for the color of your breast. You also check out for dimpling, that is it on the screen. You check out for dimpling, you check swelling or redness on any part of your breast. Then fast forward, you go down to your nipples. You gently squeeze the nipples to check if there are any discharge, any fluid-like discharge or any blood. You check if it is inverted, you check if it is out of position. Secondly, you raise your hand high above your head. And you repeat the same observation you did while putting your hands on your hip. This way you can also check for shape changes, color changes, dimpling, redness, swelling. That way you can check for the symmetrical lining of your nipple, if it is in the same lining or if it is out of position. Thirdly, you take your 3 middle finger. Most women like to do it when they are having their bath because the water makes it more slippery. But then again, if you cannot do it while having your bath, and you can do it while standing, while sitting, or while lying down. So whichever position you choose to take a 3 middle finger and then you go gently in a circular form. You start here and then down. I'm going to put this up in the screen, and then you go in a circular motion. What are you checking for? You're checking for lumps. Mind you, naturally the breast has lymph nodes. It's a little bit lumpy, which is normal, but we are checking out for an abnormal or unusual lump on your breast. It might be painful, it might be painless. You check and you check down to your armpit area. This way you can find out if something is abnormal with your breast. While you are doing your breast self-examination, please do not forget to check your armpit area, your collarbone, and then down to your armpit. Mind you, you're going to feel some lumps which is normal. Most of them are normal. You're going to feel some lumps. All we are trying to find out from this breast self-examination is if there are any changes in the color of your breast, if there are any changes in the symmetrical lining, if there are any changes in the size or the shape, if there are going to be dimpling, inversion of your nipple, or discharge. That is all what you're looking for. Every change in your breast does not mean it is cancerous or something is wrong with your breast, but it is nice for you to check your breast because every change needs to be checked and observed. If you notice any changes, any lump, any pain, anything at all that is out of the usual for your breast, please do not panic. All you just have to do is go to any hospital of your choice, any good hospital of your choice, and do get checked by your doctor. Remember, breast self-examination is not all about checking if you have breast cancer. It's just knowing your body when it is normal and when abnormal things occur. All right, thank you so much for watching and learning with me about how to check your breast by yourself. It is simple, fast, and safe. All you just have to do is learn all the steps that I have taught you right now and do it on your own. You can do it monthly. Just make it a monthly routine, and by that you can be able to save your life if there are any changes that you're not aware of. All right, thank you. Till we meet again. Bye.